Hey, this is Dr. Susan Wilder here with a October update. Hard to believe we're within a couple months of the holidays and Halloween right around the corner, and basically about 10 months into our pandemic in the United States. Just for an update, we're at 8.4 million cases in the United States, over 224,000 deaths. That's over 75 9/11s. I mean, that's a lot of Americans have lost their lives, over 7,000 healthcare workers. And that's still over 5% of the global mortality. We're no longer 20%. Sadly, other countries are catching up rapidly. And we're all over the world seeing another surge in virus infections, including nearly every state, with Arizona right now number 12th in the country for case escalation. The question is why? Why another surge? Well, this is predictable. This tends to be the way viruses work and pandemics work. It happened in 1918. It's happened in pretty much every pandemic since. And, we're all tired of it. I mean, I think a fair amount of this is due to pandemic fatigue. We're less careful with protective measures and distancing. I'm seeing people out going to indoor restaurants within 6 feet distanced, working out in gyms where, when you're exercising, you need 12 feet of distancing. And you have much higher viral load particles. A lot of our cases have been picked up in gyms, bars, eye doctors, things like that. So we've kind of gotten a little bit more lax and complacent. And when we don't see it around in the community as much, we all let down our guard, which the virus is not over it. So we need to just continue to exercise common sense. And then there's also a confusing a lot of changes in the guidance. We're hearing different things from different sides and some downright misinformation. So I'm going to talk a little bit about excess deaths. There's a lot of conflict about, well, how many people really died of COVID, and 224,000 deaths are at the minimum the number who have died related to COVID related diseases. So that could be pneumonias, that can be multi-organ failure, heart attacks, strokes, blood clots, etc., contiguous with COVID-19 confirmed infection. We have had in the United States over 300,000 excess deaths year over year, which includes not just COVID-related deaths, but deaths due to people not getting adequate medical care for other issues, heart attacks, strokes, not getting their normal preventive care, not getting their vaccinations, etc. Some due deaths of despair due to overdose, alcohol-related deaths, or suicides. So this pandemic is causing, a boatload of pain for everyone still, and we've just still got to deal with that. So I want to talk a little bit about uncertainty and evolving knowledge. While I would love to have and be able to provide clear-cut black and white answers, and it is maddening when you're hearing different things from different sources and even highly reliable sources. So physicians on one side, or epidemiologists saying one thing and others saying another. But that is the nature of science. As scientists, we're used to that. Knowledge evolves, and we have to evolve our thinking with that and revise our guidance as knowledge evolves. So anyone who speaks dogma and this is the only way and this is, my way or the highway is going to be wrong. Today's dogma is tomorrow's dog, you know what. So there's something I've learned over 30 plus years in this business. It's the more you know, the more you realize how little you know. So you may have heard some scientists came across with something called the Greater Barrington Proclamation that's basically advocating towards a herd immunity status. We've talked about this a couple times before, and it seems to be what the current administration is really listening to at the present time with Dr. Atlas. And we've talked before about, going from 10% of us having been infected or exposed to the 60 to 70% we presume we're going to need to achieve before we truly have herd immunity, again, because we don't know how long this immunity lasts either, or how strong it is, how likely you can get reinfected. But that would cause an incredible amount of deaths. Presumed, the calculations are over 1 million deaths and over 80 billion in direct medical costs and risks overwhelming the healthcare system. And then on the opposite side, another group of physicians has come across with the John Snow Proclamation, which is basically we should all, winter is coming. This is only going to get worse. We need to hunker down. And all, follow the most intense measures, and some even calling for shutdowns in particular areas. So again, as scientists, we're used to questioning everything, thinking very critically, looking at sources of information, and I encourage every person to do this, especially before sharing information, because there is a lot of garbage out there, and understanding that knowledge evolves with time. As I've also taught every physician, all the hundreds of physicians I've trained over my career, if you ever think you know it all, you need to get out of this business because you are dangerous. So bottom line, I think we want to really focus on, well, how do we find this balance between the risks and benefits? We are never going to protect everybody. If we wanted to protect everyone from automobile accidents, we would have to ban driving. Of course, that would be a ridiculous thing to do. But we put in place a number of safety measures to reduce the likelihood that you're going to die from driving. So we want to find a way to balance those risks and benefits intelligently. And that may have to be locally driven because the disease is rising and falling in a variety of places everywhere. So how do you go about balancing your risks and benefits? I think number one, we need to honestly look at ourselves and assess our risk and that of the people we are in close contact with, including coworkers, including teachers, including, neighbors that you may be interacting with. Are you someone at increased risk? It is not a small percentage of the population. Let's start with age. Your risk of hospitalization goes up exponentially with age. So for every decade over your 40s, it goes up 50 to 60%. So anyone over 65, and I would conjecture to say those of us in our 50s are also at increased risk, but anyone over 65 is at high risk, accounting for 8 out of 10 COVID deaths. Sex. Men are at much higher risk of hospitalization and death at every age, including young men. They're at a rate of 5 men to 2 women are dying of COVID in their 40s. 5 to 2. So testosterone alone is a risk factor. Race and ethnicity. We know that rates of hospitalization and deaths are significantly higher for Black or African Americans, Native Americans, or Hispanic and Latino patients. And that may be for a number of medical or socioeconomic reasons, but these are populations that need to be even more careful. Are you overweight? Most people are there's a huge percentage of patients who have no idea that they are classified as overweight or obese. So again, overweight, BMI 26 to 30, obese over 30. 30% of our children are overweight or obese. If your waist is larger than your hips, you are overweight and you are metabolically unhealthy. Which brings me to blood sugar. If you know your numbers, which we encourage our patients to know your numbers, if your fasting blood sugar is over 100, or your A1C long-term sugar is over 6, or your insulin level is over 10, or your waist is greater than your hips, you are metabolically unhealthy and at higher risk of COVID hospitalizations and mortality. And then, of course, there's hypertension, heart disease, lung disease, including asthma, smoking, vaping, taking immune suppressing medicines, including steroids, drugs for autoimmune conditions, or chemotherapy. So are you at risk? Is anyone in your household at increased risk, or any of your close contacts at increased risk? If that is the case, then we got to exercise a higher rate of caution. Second piece of information you need to look at is what's happening with the disease in my community. So we look at a number of different sources. Locally, I'll look at the AZDHS dashboard. So if you search AZDHS COVID dashboard, and I look at what's called the EPI curve, confirmed COVID-19 cases by day, and the hospital-specific metrics. These are confirmed cases. There's deduping software, so the same person tested multiple times is not counted as another case. And that tells us that, you know what, our cases are going back up. They are now where they were at the end of our huge spike in July. So, and we know that rate can rise very rapidly, exponentially. So we need to be on alert. The other thing you can look at is called rt.live. And this is the virus reproduction rate. If it is above 1, the virus is escalating in a community and can do so exponentially. If it is below 1, which right now there are all of 4 states out of 50 that have an RT below 1. So this can tell you what the cases are doing in the community, and if you are at high risk or in contact with somebody at high risk, then we've got to escalate our caution. So that's avoiding crowds, indoor dining or bars, indoor exercise unless they're using 12 feet of spacing, and very, very tight infection controls, including masking with exercise, and that is not fun. And then all of us need to continue effective common sense measures. A recent study of 127, I think, or over 120 mask efficacy studies confirms they are effective at preventing spread to others and reducing risk to the wearer. So we got to wear masks in public places, keep your distance, wash hands religiously, just common sense. And then it's important to know what is a close contact. So that means greater than 15 minutes of time in contact with someone within 6 feet. And that can be 15 minutes cumulative throughout the day. So it could be a minute here, a minute there. So think of your coworkers. It can be masked if that person is sick. So again, when you're sick, you do not go into work. You quarantine, regardless of test results. Remember, test results have a lot of false negatives, so they are not reassuring if they're negative. They're confirmatory, but they're not great at reassuring you if they're negative. So yeah, assess your risk and that of people that you're close to and that you're in touch with regularly. Assess the disease spread in the community regularly. Continue your common sense basic protective measures, and understand what a close contact means. And if you are in close contact and end up with a person who ends up testing positive, then you've got to notify us immediately, monitor for symptoms closely, and get tested ideally in about the 3 to 5 day point when you're most likely to turn positive. I want to talk briefly about the holidays. Halloween's coming up, and we want it to be fun for the kids. Schools actually opened without huge surges of cases in our community because most of the schools are doing a really good job of monitoring temps, masking, hand washing, hygiene, spacing as much as possible. So I'm super thrilled that we didn't see huge case spikes as schools started to open up, other than some of them in the colleges, which I think they've done a phenomenal job getting those under control. If you have children, please check the CDC guidance on what are considered low, moderate, and high risk activities. There's a lot of fun low risk activities like pumpkin carving or cookie decorating or other crafts in a spaced way outdoors with a few neighbors, or doing scavenger hunts, or a Halloween movie night, or virtual costume contests. If there are kids trick-or-treating, make it safe by washing your hands before putting together little treat bags that they can just grab and not have to reach into a bowl where other kids have reached, which would be a very unsafe thing. Keep that tray 6 feet away from you, so you are not in close contact with any of those kids either. Val, our family nurse practitioner, suggests you could also create kind of a fun candy slide using a 6-foot PVC safely distanced candy shooter that will shoot candy right into the kids' bags. Ideally, as you get candy home with your trick-or-treaters, sanitize wrappers, or just let the candy sit for 2 or 3 days before inspecting it and allowing them to dive in. That would just reduce the likelihood that there's any residual virus that may be on wrappers. Because remember, there is a lot of stealth spread of this virus, and many of us are infectious when we don't know it. Travel for the holidays, there's a really exciting positive research showing that because of the rapid air changes within an airplane, that air travel is quite safe if everyone is wearing appropriate masks. The one time we flew during this pandemic, there were a lot of inappropriate masks. So a one-layer bandana, open bottom face shield with no bottom mask, masks with valves are all not protective of anybody else. So those are not adequate. And I think we just have to consider for the holidays, those of us, again, who are at high risk, which is pretty much my entire staff, either are high risk or live with someone who's high risk. So testing prior to travel is only somewhat reassuring, again, because false negatives. Testing alone is not sufficient as a strategy. Testing combined with distancing, combined with masking, combined with hand washing, that's an effective strategy. Trying to keep gatherings outdoors, which in Arizona we're very fortunate to be able to do. Distancing and mask use all add those layers of protection that avoid those holes that could get somebody very sick or worse. So stay socially connected, physically distanced. Tough it out. I know this is a marathon for all of us, but I know we can do this together if we just take care of each other. Stay safe, enjoy this fall weather, and happy Halloween.